Hi, I'm Dr. Nancy Sudak. I'm the Executive Director of the American Board of Integrative Holistic Medicine, and we're here with Dr. Dave Rakel. And thank you, Dr. Rakel, for taking the time to be with us.
My pleasure.
So Dr. Rakel is on the Board of Directors of the American Board of Integrative Holistic Medicine. He's a founder and director of the University of Wisconsin and Madison program in Integrative Medicine, and also an associate professor in the Department of Family Medicine. So Dave, is it possible to teach how to facilitate healing?
I believe so, Dan. I mean, it is a controversial subject. Some people would say, no, we can't. Others would say, yes, we can. Some people believe that we're just have this innate personality that's hard to change. In fact, in Europe, in medical education, they will often bring in acting coaches to try and teach empathy and compassion. And that actually works pretty well. But what bothers me is it's inauthentic, that if we're trying to act a certain way without being a certain way, another human being can pick up on that. And I think if we're going to really be authentic in order to teach how to facilitate health and healing in another person through our presence, that we have to first do this for ourselves.
And what are some of the ways that we can learn how to do that for ourselves?
Well, so in creating this curriculum of how to really create a, I don't want to sound trite, but a healer. You know, it sounds a little trite, but it's really what we're trying to do is in the future, we're going to have these big mega computers that'll tell us the differential for everything we want to know. But that computer will never be able to really be present and understand through our intuition and understanding of a complex story and be able to attach a lot of various bits of information into a conclusion that will lead towards a path towards health. So I think there's our opportunity is to help understand in order to do this well, we have to do it for ourselves. And I think that's the main key, and that's why the American Board of Integrative Holistic Medicine focuses on this so much, is that we need to first start with ourselves in order to be best prepared and train ourselves to best help someone else. Because it's really hard to sit with another suffering human being if we're suffering more than they are.
Yes. Well, can you talk about how integrative medicine has changed or will change the shape of research in the future?
Yeah, I mean, it's been really exciting. This whole field, you know, we always hear, okay, where's the evidence for that? But now we're starting through NIH support and other funders to realize that we can't do research the way we did in the past. That the randomized double-blind placebo-controlled trial is really good for a supplement or a medication, but it really doesn't work well to understand how complex systems heal. So if we're going to really look at the end point of what we want to achieve, which is health for a complex human being or even a community, we have to say, okay, what does health look like at the end product? So what do I want to achieve? So if I want to achieve better health in my community, so I have more resilient, healthy human beings who are kind to one another, what type of intervention would I need in order to facilitate that outcome? So we're starting to realize the importance of more of a pragmatic or practical randomized controlled trial where we decide what we want to achieve, which hopefully is health for our community. And then we're not so concerned about the drug or the pathophysiological process, but we might include a number of different variables into that, maybe through the patient-centered medical home and primary care, maybe by incorporating a team approach to say, what does this community need to be healthy and how can I achieve that? And that's really encouraging us to do research in a new and exciting way that is really expanding our awareness into how to study complexity.
Well, would you be willing to give an example of a research project that you did?
Well, one that comes to mind that we did not do, but I think is really a good example of a pragmatic controlled trial, is one of neck pain. You know, we might just look at acupuncture, or we might just look at a muscle relaxant for neck pain, but they did a pragmatic trial where they had different groups of therapy. So one was just education for the neck pain, one was a physical therapist who was able to not just follow a protocol based on the research direction, but they were actually to really match the therapy to the unique individual and what they needed. And then there was also yoga therapy for that. But it wasn't just the yoga therapy, that was combined also with an emotional awareness process of how stress can be held in the neck. And then you look at those 3 different arms and you say, which one works best? And then we try and reproduce that. We're not so concerned about what chemical it is that we're influencing. Now that research is important too, but we're more concerned about the outcome in helping that person with neck pain. And how could we improve their quality of life so they need us less? You know, it's not that we don't want them to come see us, but we meet them in a different way. And this is what we're trying to do with American Board of Integrative Holistic Medicine, is educate people to feel more prepared to really appreciate and sit their complexity so we can move in a new direction. And we need research as our guide. You know, this whole evidence-based medicine process is transforming to evidence-informed medicine. Because if all we did was practice evidence-based medicine, we wouldn't be able to prescribe much, because we just don't have enough evidence for that. So evidence-informed medicine says, hey, this is really important. It's going to help guide us towards not harming and really helping that individual.
So what are some of the resources that you would recommend for individuals wishing to learn more about this kind of research approach?
Well, the research approach is evolving as we speak. And I think the National Institutes of Health, the National Center for Complementary and Alternative Medicine is probably the best resource for us to understand how we are using more of this practical outcomes research to really understand how we can add value to healthcare delivery.
And what about, so in addition, what about resources for teaching integrative medicine in an academic setting? What would you recommend for that?
So there's a lot of good resources. We're biased, right? But we really believe strongly in the American Board of Integrative Holistic Medicine. And we have our syllabus that is quite expansive in regards to what it offers. One thing after starting my fellowship in 1999 was I felt that there was a tremendous need to create a resource for primary care docs specifically to understand how to use the evidence that we have to help guide us towards really integrating both traditional and non-traditional methods. So we just published the 3rd edition of Integrative Medicine, which I edit, but a lot of my friends, including you, have contributed to. And it's really a work of love, I'm going to say it. But we hope it really acts as a guide. And it's divided into 3 sections. The first is the art of what we do. It's the healing encounter. It's the philosophy of this field. And that's just 3 chapters. But the majority of it is a reference text. It's what if you want to use an integrative approach for neck pain? And what's the evidence for yoga for neck pain? What's the evidence for acupuncture? But we also have a little icon that rates the evidence, the weight of the evidence, but also the weight of harm. And that's something you don't always see in traditional medical texts, because I think what we have going for us in integrative holistic medicine is that we are using therapies that maybe match the patient's belief and culture better, and they have less harm in regards to some of the other therapies that we're more used to prescribing in conventional medicine. So after each chapter, there's a therapeutic review, and there's an evidence versus harm icon, which is an arrow. The more up it is, the better evidence with the least harm. The more down it is, the worst evidence with the more harm. And so that's a really quick little icon that helps guide the reader so they can, if they're seeing someone with hypertension, they can just turn right to it and just skim the summary. So it's meant to really be a guide in their practice. And then the last section is tools for your practice. And these are educational, quick chapters to help us learn how to do an elimination diet, or how do I do self-hypnosis for abdominal pain or headaches? What can I learn about reducing the toxins in my environment? These are really practical how-to chapters that we just want to really give guidance based on research, but also a lot of these authors have years of clinical experience, and we want to share that with other physicians and healthcare practitioners and clinicians to really help us move towards creating more of an excellence in salutogenesis. So this excellence in how complex systems heal. And that's what we're doing together, right? This whole organization is creating an excellence for health, which we already have a pretty good excellence for disease and acute and catastrophic care, but we need a better balance. And if we're going to add value to healthcare where we have improved outcomes with reduced cost, this is what we have to explore.
Dave, what are some of the factors that you think will have an impact on our current disease-focused model of healthcare?
Mm-hmm. Well, you hate to focus too much on payment, but it really does drive what we do. You know, we need a currency for health. Right now we have a currency for disease. And I think once we can figure out how to pay healthcare teams to really reach out and create health for a community, we're going to create a focus for us to do this together. And I think the team of the future will be maybe physician-led, but not physician-dominant, that we're going to have other professionals in here and we're going to choose that profession to best serve the needs of that specific community. So if I have a community that has a lot of obesity, I'm going to maybe choose a psychologist, a nutritionist, maybe an exercise physiologist. And we're going to work together to create these programs. But how do you pay for them is the key. So if we can figure out how to reward health and the outcomes that we want to achieve, I think that's ideal. Now, some businesses are starting to do that. They're saying, hey, my healthcare premiums are too high. I can't make my business work out because I'm spending all this money on healthcare. And they're saying, hey, I'm not going to pay these high premiums. I'm going to give money directly to a patient-centered medical home or a health clinic to manage my population in my business, not just to treat their disease. You can do that. Obviously, that's needed. But to also facilitate their resiliency and their presenteeism at work and their creativity. So give me what I want from my employees if I'm spending all this money. And I think if we do that, if we continue to pay for acute and catastrophic care through the third-party payer, through the insurance, but then also directly allow money to flow into the community clinic. So we have a resource to bring in these teams of professionals to reduce the cost because they don't need to go in for dialysis, they don't need to go into the hospital or urgent care as much because we're really focusing on what that unique individual needs to be well. And we're just exploring how to do that, but I think through businesses is a real low-hanging fruit there, that if businesses want this for their employees, we'll give it to them. But give us the money to do it because we need that support to create these teams. And that's how we'll create this currency for health.
So that's an excellent and hopeful answer. It does suggest that integrative medicine in many ways is the solution to our healthcare crisis.
Well, you and I are biased, so we would agree with that. But it's just good medicine, right? And drop the adjectives. And this should just be what we do for our friends in our communities and the people we care for. And it's not that the old model was wrong, it's the best we could do. But now we're starting to be insightful and to understand we need to do a little bit differently. And we need to start to pay for what we want.